Hi, my name is Dr. Hendrée Jones. I'm a professor at the University of North Carolina at Chapel Hill in the Obstetrics and Gynecology Department. I'm a psychologist by training and very much look forward to talking with you today about how to involve families and care providers in the substance use disorder treatment for women. So, what we're going to cover today will be for tips for how to work with families of women that have substance use disorders. First, it's really important for women to be able to define families for themselves. And that could very much mean we are going to be talking with non blood related relatives, non legal relatives, such as friends, intimate partners, aunts, grandparents, children. Again, women get to define their family. Whenever you have the family that's in the room with the woman, we need to know who they are. So making sure that we're taking the time to get names, roles, and also checking with the woman to make sure she feels comfortable that who is in the room should be in the room. And being the gatekeeper for if someone is making her feel uncomfortable, that you are taking control and asking that person to sit outside while you have that conversation. It's incredibly important to start with empathy for all people that are involved, acknowledging the stress, the concern, the emotional difficulty of the situation of having a loved one that has a substance use disorder, and expressing understanding of the family's concerns. Setting parameters of safety is also so important. So letting them know the limits of confidentiality, what you can share, what you can't share, and that the woman is in charge of her treatment plan, and we are all here to support her. You'll want to take some time to educate with very basic concepts about what addiction is, how medications, if they are being used, are working in the brain to not replace one habit with another, but to be able to provide medication to stabilize the mechanisms of the brain to allow that woman to have the most fulfilling and healthy life possible. Also, be open and curious. Encourage the family to share observations and concerns by using open-ended questions to facilitate that open dialogue. Also, giving the woman the opportunity to share her own worries, concerns, perhaps fears, perhaps the feeling of being judged by the family members, and all in the hopes of finding out what can be done to help support the woman and the family in this process. Also, too, making sure that we ask about positive aspects. What are some positive strengths that the family members see in the woman that you are serving? And also asking the woman what she needs from the family members to be successful in her treatment. We want to make sure that in these conversations that we avoid blame and judgment and stigma and discrimination. So not assigning blame to the family or the patient, but instead let's focus on solutions and support. You want to be able to offer treatment options. What are the different treatment options, not only for the woman, but also to think for the family, what supports might they need? Might they be thinking perhaps else in their family has a substance use disorder that also needs help? And providing those other resources like Al-Anon, for example, for family members. And then finally, we want to be aware of cultural considerations. In some cultures, it is very expected that males accompany females to every medical appointment they have. So think about how you want to negotiate that in terms of being able to provide the best treatment. Other pieces, we want to make sure that patient privacy is kept and maintained. So if she only wants one member of the family in the room with her, she gets to have that. If she wants no members of the family in the room with her, she also gets to have that too. Making sure that we're giving that direct communication, that you need the patient's permission for anyone to receive information and to be or not be in the room. And then thinking about what to do if that partner might not want to follow your direction, right? So we need to be firm, but also respectful at the same time and state that you can't complete this visit with the partner being in the room. We're going to kindly ask them to move. And if you need an additional support member to escort them out of the room, that might be something that needs to be considered. And then certainly you want to document the situation in the patient's record in terms of who is in the room, what happened, what that conversation was. When we work with women that have substance use disorders, many of them have children, and we need to make sure that we are asking about the children, asking how she would like help to talk about what it's like to have a substance use disorder, to talk in very simple language for children, I want to give a shout out to Carly at Sesame Street. This is a wonderful character that is living in a foster care situation who is a child who has a mom who is in treatment for substance use disorders. Those Sesame Street materials can be a huge resource, as is Hey Kiddo, a book that is really meant for children that have family members in active addiction. So you want to be able to convey information about the mom's substance use disorder with the mom there and talk about that substance use disorders are a sickness, that the parent is not a bad person, but that person has a sickness and they need help. And also understanding for the child that they are not the reason that parent has a substance use disorder. They're not the reason that the parent might drink or use drugs. They didn't cause the disease, and they also can't stop the disease, right? So also explaining that there are many children that are in the same situation and that they are not alone, and encouraging them to think who among those adults can they go to for support and help. Many times, our women with substance use disorders are also engaged in parenting with others. It could be an estranged father. It could be that they don't have custody of their children. And so they might need some help and support negotiating how they are parenting with others. So, some tips for that are making sure that you're giving her tools and support for helping her establish open and regular communication with those other parental figures in the children's life, making sure that she keeps all of her interactions respectful. She can't control what others do, but she certainly has control over her own behavior. To treat that other co-parent with courtesy and empathy and understanding. And always encourage a child-centered focus. Even though adults might not agree all the time, they might have disagreements, they always need to be firmly prioritizing the child's needs and the well-being above personal feeling. Reminding everybody not to trash talk or talk negatively about the person or parent with SUD. Give ideas for information sharing. How can the mom be a part of the child's life? Learning about health records, education, routines. How can the parent, if they're coping with separation, maybe write letters, maybe provide videos, maybe have some social media contact with the children, again, with CPS in consideration if Child Protective Services is involved, and then provide that positive reinforcement. How can the mom celebrate the child's positive experiences and share appreciation for the child's growth and development? And finally, if nothing else, you as a provider need to acknowledge the grief, the anger, the loss, and the pain that a woman might feel if she no longer has contact with her children or children have been removed from her care due to Child Protective Services. So often we brush that grief under the rug, and that is not helpful for recovery. So thinking about who is your care team, right? How do we engage other care providers in the work that we are doing? So you're going to need a whole village of care providers to do this work. And I want you to think about the list of potential partners that you have, because some of those partners, I'm sure you'll be able to see on the screen, other primary care providers, dental providers is such an important part for women to have a full recovery from substance use disorders. Thinking about other alternative health therapies. Maybe there's acupuncture or massage that might be important. Thinking about reproductive health and family planning. Thinking about other peer support groups that might be there, other caregiving support that the woman might need, childcare or other like forms of daycare. Thinking about the criminal justice and child welfare systems. Who do you know in your community that is seeing a lot of your patients? How can you partner with them? Call them up, have conversations, get to know each other. Thinking about housing, workforce development, food assistance, and communication like cell phones. And then sexual assault support is homelessness are things that our patients face, and knowing the resources in your community can be so important. So how do you establish those partnerships? Here are a couple of tips. Make sure that the partners agree on the reason for maintaining that partnership. For example, we have a retired judge that we work with very closely that helps provide legal coaching to our women. We are very clear on what he is providing and what we are providing. We're also very clear about the limits of confidentiality and how we are getting a release of information from that retired judge to be able to work with our women and share information. And then he can share information with us. Another tip is to identify that common goal or outcome. So maybe you want to have a seamless way of referring patients to a homeless shelter, right? So making sure you have that conversation with who those partners might be, even coming up with a memorandum of understanding about what you're going to be providing and doing and what they're going to be providing and doing. And then how you share those responsibilities so that neither partner feels overly burdened with the work in this relationship. And then finally, we want to identify some potential challenges and some potential solutions up front. So thinking through what might those barriers be and how we can overcome them before they even start. Just in terms of key takeaway messages, we really need to know for the woman who has that substance use disorder who she's identifying as family, what support she wants regarding her family and her SUD treatment. If she has children, it's important to give her the tools and support she needs to be able to talk to her children and those who may be parenting her children about her substance use disorder and her treatment and how she can be the best parent she can be to those children. And finally, recovery absolutely happens in a community. So knowing and fostering community partnerships is key to helping provide women the most effective treatment and recovery for their substance use disorder. Thank you.